Today, we're going to be talking about men's health.
American men are dying sooner.
Drug overdose, suicide.
Drug overdose rates for men.
As a man, you're supposed to be tough.
Hold on to feelings and emotions.
I know a lot of people ashamed to talk about it.
I don't think you go to school to be a therapist. I think you're born as one.
Behind the scenes, what are we as therapists talking about?
The idea isn't what you do, but why do you do it?
The why is almost always more interesting than the what.
That's the unsaid thing.
Oh, I'm saying it. I'm going there.
Right now, I've got the largest caseload of men that I've ever had in my 13 plus years of doing therapy. Wow. And it's been amazing to see the diversity of challenges that men are dealing with and being willing to work with me on and how we talk about it. Mm-hmm. It is a different experience sitting with man and attempting to help him from a mental health standpoint. So I'm really excited about what we got to say.
Okay.
Yeah. What do you see as different about it? It's a different experience.
The first thing that I noticed pretty quickly is how we communicate about it. So typically when I've worked with women, I've heard things about how it makes them feel. I've heard things about, self-value, things of that nature. They can articulate that, or at least they tend to start by articulating that. Whereas with the guys, it normally, the challenge starts outside. So there's something going on at work. There's something going, the wife is complaining to him, or the partner's not satisfied, or the parents are upset with the young man. It's outside first. And then as we get to know each other better, as we work through it, in the evaluation, sometimes the language just isn't there. It's just kind of listing off things that are issues. But as time goes on, it becomes more of an internal process of how do I actually feel about this? What am I actually thinking about this? So I would say with the ladies that I've worked with, and I've been very fortunate to have a good amount of experience working with ladies on the caseload in the past, they may start inside and then it moves out. Whereas with the guys, I've experienced that it starts outside and typically starts to move in.
Yeah. What do you all see as some unique challenges for men related to mental health?
Ask you that. You answer the question.
It's a lot easier if I ask you all the question.
Yeah. Matt liked to play like he the interviewer, even though he's part of this.
Yeah.
I think one is there's a shame to it that's a little bit different. Not that men deal with shame more than women overall, but I noticed that there's more shame about having something going on with mental health, something emotional or psychological. And similar to your point, a desire to externalize it as well.
Oh yeah.
Like, oh, it's just this thing wrong, this thing wrong, this thing wrong. Which, they very well might be stressors or triggers for different things. That's one thing I see that's different. I don't know. What about you, Craig?
I was going to add to that. It's different because the idea of men and mental health, how long has that idea been around? Think about it. We're three men who are therapists. When you came into the profession, how many men did you see as therapists?
How many men do we see now?
How many men do you see now?
I got some stats.
Oh, you got
okay,
some
you got
stats?
some stats. All right.
Prepared. Y'all ready?
I'm ready.
Go for it.
I can Google. Let's see. So it says only 29% of psychologists are men. That's dropped from 39% just in the last 10 years. Psychologists under the age of 30, only 5% are male.
Wow.
So among 30-year-old psychologists and below, 95%.
I'm the ripe old age of 37, but I started being psychologist at 28.
You look 25. Look at you.
I know.
I don't know what your skincare routine is.
Dashing.
He was fishing for a compliment, by the way.
I was totally fishing for a compliment there.
So with school counselors, it's between 6 and 7 times more likely that the counselor's female. Yeah. Substance abuse counselors, special need teachers, they're all very, very strongly female dominated, even though many of those cases,
the recipients,
most of their clients are male.
Yeah.
Well, so
in those settings, at least.
Right. So what we're talking about is we came into this non-male dominant profession, but ignore that aside, are men taught to feel and experience? Right? How many times have you seen, heard, or said to a boy, hey, you fall, just get up, wipe off the dust, no crying? Right? So men are from a societal standpoint, I do believe there's a shift, but there's this idea that men aren't supposed to act and respond a certain way, which is why we externalize how we feel.
Oh yeah, stoic.
Yeah.
Got to be stoic. You know, you can be angry, but even that's kind of gotten tempered over the recent years. You know, too much anger, you got anger management issues. But sadness, not a lot of room for sadness,
Right.
not a lot of room for processing sadness. Matt, you mentioned shame. You probably want to touch on guilt at some point in time. Those emotions, what do you do with them? How do you communicate them?
It's a complex topic of teaching and allowing men what I call sometimes emotional equity. How do I teach you how? First, I can't teach you how to feel unless we understand how do you feel. Where do you feel it? What anger in men, is it depression? Is it anxiety? What is it? So we see the behavior, but how do we safely explore how I feel, and how will my contemporaries respond to that? Right. If I'm a man and I'm talking about being anxious or afraid, can I go there?
Am I still seen as a man if I do that?
Right.
That's it. Yeah.
And here's one for you. If I'm in a relationship, can I go there in the relationship? Is a relationship safe?
Will you
for
still
it?
respect me if I let you know that I'm scared?
Yeah. So
I'm worried. Or do I have to be on all the time?
Yeah, and also there's something where assumptions about things that this is something that only women experience as well.
yeah.
That's a commonality, but it's unique to men in the sense that they're not, I guess there's a spirit of a lot
expression.
of this, but that they not that they either shouldn't be or that they don't experience. Where I'm going is one thing that I think would surprise a lot of people, because we're hearing the inner thoughts of men in these therapy sessions that they're not
Sharing with the world.
sharing with the world.
Yeah.
It makes me, this is another stat in here what I was looking at it was saying 40% of men have never spoken to anyone about their mental health. But is with body image. How many men have issues with body image? Which I don't know. I think when I say that to a woman, they're very surprised.
Oh yeah.
You know, obviously, women. This is one area where I do think it's tougher for women, issues with body image and the social piece of it. But that it's very common for men as well.
When you reduce people down to their body, I think that has historically been something that's far more experienced with women than men. But despite the fact that it may be disproportionate for those men that do experience it, and I mean, I can't go as far as saying I know all men experience this at some point in time, but men have concerns, men have questions, men, you go in the locker room, there's a sizing up that goes on amongst you and your peers. That's not unusual. That's not just a sports thing.
Yeah.
You know, you all had PE class. We all had to run around the gym every now and then and notice who's getting attended to and who's not.
Right.
Because before there was a job where you can earn that income and maybe stand out in that way, there was prowess. There was how do you present when you are matched up with your peers?
And you and size, right? So are you
Where are we going
over
with this,
6
Craig?
foot?
Where are we going?
Height wise, right? Because it's posturing, right? So I get to posture and look, I stand 6'4". How I enter a room, how I posture, how I feel about certain things is going to be perceived differently than you.
Yeah.
Right? So how I feel, I think it's amazing. Forget how I feel. 40% of men.
Craig, we're not forgetting how we feel anymore as well.
Oh, okay.
Yeah, we can't do that in the
Johnny,
podcast.
work this out with
All
me.
right, work it out. 40% of men have never talked to anybody about how they feel.
Oof.
Yeah, about their mental health. Yeah.
Wow.
That is devastating. That number is very close to 50.
Has certainly not sought it out in any kind of professional sense or chaplain or
But
therapist.
that's almost
anything.
half of the men. That's always almost half of the men. And I'm guessing that maybe this is exclusive to the U.S.
Yeah.
So U.S. men. So that's almost half. That's almost half. That's
So
scary.
you're taught to suppress because you haven't been taught how to feel. And you haven't been allowed to feel how you feel. So you suppress everything that you experience. How does it come out? Right? Like we were talking off camera about men and mental health, and how many men show up to their kids before they're verbal versus nonverbal.
Start
right?
moving around.
Are you present with your kid? Your wife gives birth. Can you sit with your kid and change diapers and understand the different cries and the cry for food and I'm dirty? Or you the father who shows up when the kid can verbalize, this is what I want, right? I don't know if that's men's mental health, but that's maybe men being more engaged and in tune. So maybe it is mental health, engaged and in tune to how you feel, how others around you are feeling and experiencing. I don't know. I'm just talking out loud and rambling, but yeah.
No, and it'd be interesting to see where some of this goes as well. Because in a lot of ways, men or boys and young men are falling more and more behind in terms of like educational attainment, certain things within the workforce.
Oh, yeah.
But like there's this deterioration and more these deaths of despair when it comes to overdoses, suicides. To see where this, I say interesting, not.
No, I get what
Not-
you're saying
not
when you say
positive way.
interesting. You're saying
But,
interesting in the fact that when we see these things happen on the scale that they're happening and the way that they're happening, it draws your attention. It needs your interest. You just mentioned suicide. We were talking just a moment ago about how men tend to be more lethal when they attempt their lives. And as a result, that process tends to get completed more often when it's a male who is behind the process.
Men use guns. That's really
Men use
where it
guns.
gets at, yeah.
Men use guns. Men tend to be more lethal. Something else that comes out of that means there's an absence of men. So when I'm not doing well, I'm not talking to people, 40% of us aren't, I'm going to take myself out of the equation. And that's one less guy for the young boy, the young man to communicate with about going through the struggles of life and overcoming them.
That brings up an interesting point too of for these boys, who are the men that are there in their life? Because most of the therapists are women.
Educators.
It's getting more and more where it's almost, at this point it's getting close to every educator being a woman.
Right.
At least the lower you go in age too.
And the guys
single
out of the
parents.
home.
Yeah, you were talking some about this. What were you saying before about some stuff with not having a father in the home?
Incarceration.
I saw it was a presenter was making the comment that boys raised in 2-parent households and raised by single fathers are less likely to be incarcerated compared to boys raised by women. She was making a statement that because men who find themselves in prison are reacting on or have responded with emotion, and it's lethal, but they responded with emotion versus having had a man in their lives to say how to sit with emotions and how to learn. It was very fascinating. I didn't get to finish listening to the entire thing, but that was a piece that stood out.
Modeling.
Big
time.
Yeah. How do you model? And so when you talk about men's health, I mean, that's the modeling aspect. Who's taught you how to feel?
Yeah, and this, I would imagine too, this sense of abandonment and attachment stuff that can come from that as well, and maybe socioeconomic stuff that's impacted with that too.
Self-esteem.
But I think
I don't know where I come
self-esteem.
from. I don't know where I come from. I don't know how I'm supposed to be. I happen to be a guy whose father was in and out of my life. I call him a peekaboo dad. And I'm very fortunate for the strong women that were in my family, my mother, my sister, my aunt, my grandmother. They absolutely did a splendid job of giving me all that they could, but none of them could teach me how to be a man. They struggled in relationships with men. My mom was unmarried. My sister attempted to be married for a time, and that didn't work out for her. My aunt never married to my knowledge. My grandmother lost her husband. So I'm not seeing them in relationship with men and having success on that front. So I had to go out. I was thankful. I had a few male teachers. I got to college and I started to get mentors. But I needed these men to come into my life to give me some understanding beyond just me figuring it out with my friends. What it meant to be a guy, to be able to deal with emotion, to be able to express emotion. And it's essential to me that if you want to help young men, if you want to help little boys, you have to have some space where men are in their lives.
Yeah, and I'm not a fan. I think it's a dead end to this thing of labeling masculinity as toxic. To me, that it's a dead end, and I don't think it's the framing that we need. I think it's celebrating that masculine. And I know what's being referred to with these certain things with toxic,
Well, the
So
fact
I
that it's
get the
being
point,
the
but-
fact that it's being associated with being male, being
That's
man.
right.
No, this is abuse.
Right.
Let's call it what it is.
Right.
When you treat people poorly, that is not about which chromosomes you have.
Mm-hmm.
That's abuse. And I know toxicity is a very popular catch-all prefix for things. And I get it. It's the jargon of the day. But what is it doing? It is lumping things together that can be distinguished in other ways. So let's call that what it is instead of just kind of getting a cool, catchy term. And as a result, half of the population is now seen as a problem off top. Presence off top.
That's a good point. It makes me think too of expanding the idea of masculinity to include an emotional intelligence,
Yes.
relational intelligence, but that doesn't discount some of the other things that are thought of as traditionally masculine, which I don't think are inherently a problem.
They're not. Not
Some
always.
of it can go sideways, and
Right.
men are more dangerous than women. They're more violent crime, all of these things. But I think there's a certain thing to the masculine energy, and even traditionally how it's expressed, that I think we don't need to abandon and never could really abandon.
Right.
And I don't think we need or should, but just expand it and make it in a way that's more adaptive.
One thing what you're talking about is you both said it, the catch-all terms.
Right.
Right. I often find myself asking questions of clients, male, female, boys, girls, whatever. What does that mean? Because I don't know what it means. I think I know what it means, but that's my definition.
Say the
What's your
same words but
definition?
mean different things.
Right. So I'm with you about, what's masculinity mean? My first thought is secured in who you are. Right? Hey, this is who I am. This is how I function. This is what I do. Not that I'm right about it, but I have some awareness about me, whether it's through mentors, father figures, man in the church,
Uncles.
community leader,
Let's not
uncles.
forget those uncles.
However you came about it, you have a foundation, and then you expand the foundation with experience and knowledge. But
Yeah, not that these things have to be exclusively.
Yeah.
I'm trying to think of the alternate point of view and what people might say in response. That they have to be inherently male
Right.
or masculine.
I think that's why the term itself gets to be complicated, because what's been associated with being male, it goes back to a time where gender roles are very fixed and organized in a way that's not consistent with how they are now. So male provider, male protector, male disciplinarian, these roles that were associated with being male, they typically were built on those gender roles. That's where they came from.
But could you also say when they were built, and now we're going deeper into this, is that a two-parent household too?
Also
Where
built
the-
there.
Right. So those roles make sense potentially in a traditional home, but you step outside of it, that might be where it becomes problematic. Is I'm defining it. It's a 1980s, 1950s term, but we're putting a 2023 context on it. So the context of it also is
And it's blind to things because it's not as if being a nurturer is inherently got to be feminine. It's not as if being a provider, women provide many things to children. In some cases, they install emotion. They sit there and they hold the baby. Men and women interact with babies differently. Talk about nonverbal babies. Men typically play with babies. They try to entertain them to keep them from getting upset. If you look at how a woman holds a baby, in many cases, she'll hold the baby in front of her and she'll speak the emotion into the baby. Oh, you're a happy baby. Oh, that was funny. Or it's giving the emotion in. So that's providing something as well. That's not just nurturing. But when we put things in boxes and we limit them, we make things black and white, almost everybody loses.
Yeah.
Because I have to fit into a box. I'm a human being. I can't fit into a box. She's a human being. She can't fit into a box.
There's a box.
There's a box, ready made.
Really?
The stork dropped you off.
Didn't see it.
And if you're lucky, Amazon will bring the rest.
I had a big box. So what do you see in terms of masculinity or mental health? Let's go mental health with men based on the men that show up in your practice.
In what sense?
The type of men that show up. Why are they showing up? What are you seeing?
I'm seeing a lot of depression, a lot of anxiety, a lot of substance use
Okay.
too. A lot of substance use. More so than with my female client. Now this is all anecdotal, but I think men do have higher rates of substance abuse actually. But
And often have been known to introduce the substance into relationships as a way of connecting and maybe,
yeah, so those are some of the things things that are the issues themselves aren't like so categorically different from what women might be coming in with, but how it's expressed, what it looks like can be different, especially with the younger guys, where it can look more like behavioral problems than we would label a young female, a young girl, an emotional mental health problem. Now this isn't across the board, but a lot of times it's more getting in trouble. It's more the defiance. It's more of, skipping school.
You really
got to
act out too, because boys will be boys.
Yeah.
So there may be a little bit more rope given instead of it being seen as this young man, this little boy is going through something. It's, well, boys will be boys.
So I think that's one difference. A lot of relationship issues too, where my marriage, my relationship isn't going well, and I don't know what to do.
So identity.
Mm-hmm.
Because if we're talking young adults, teen boys, young adults, adult men, it's going to look different, right? And I think that with that married man who has maybe kids, maybe not, has been a provider. Kids are about to fly the nest, leave the home, go to college, whatever the case may be. Who am I? I'm a provider. I'm a husband. But how many married men have? I love women. Married women are great. They have book club, right?
Where is your community, fellas?
For the men, how many men have a community, right? Okay, outside of the guys, you got poker night maybe quarterly, if that.
Bowling maybe.
Right. So you don't have a network to just talk to, or men who know you, who can connect to see it come out.
That's a big one.
Yeah.
I wouldn't think,
We get married and then we lose identity about who I was, and we don't expand it. We actually contract it.
And oftentimes we start losing buddies because we tend to die younger. We tend to live more reckless lives. So now I start to lose buddies in my 30s and my 40s. I'm getting into my 50s, and it's only so many of us left that I was even okay with in the first place.
And now I'm ready to retire and have no idea what to do.
And I don't necessarily want to go out and find those new guys. I don't want to have to deal with all that. I'm so responsible. I got stuff to do. Where do they fit?
Yeah. So one question I'd be interested to hear your all's, and I've had this actually just in my personal life, opinion on what would you tell a guy who's having difficulty in some way, who's kind of thinking about going to therapy but is pretty hesitant about it and not sure? What would you tell him?
Here's my plug for Psych Today. You guys owe me money. Get on Psych Today and look for somebody that can help you think about your stuff the same way you would that power tool, the same way you would that new vehicle. I want you to get under the hood. I want you to really explore. I want you to make some phone calls. I want you to talk to the person. Listen to how they engage you, how they interact with you. Listen to yourself internally. How do I feel after I finish having this conversation?
Yeah.
Can I engage this person? Because before you get to the depths and the deep, dark stuff and all of that other stuff, can you connect at that surface level? Can you shoot the, pardon my French, shit? Can you shoot the shit?
It's not French.
But can you do that? Because you may need to do that as a warm-up, as a build-up to connecting. And there's nothing wrong with that. That's a different way of communicating than may be expected. But if that's what you need, know thyself. That would be mine.
What do you think, Craig?
I think to consider it, number one, takes a ton of courage. I would say that I would love for any man coming into therapy to find the right therapist the first time around. If you don't quit on it. Maybe you got to find somebody else. listen to your gut. I just often ask, hey, give it 2 sessions, give it 2 to 3 sessions. If you don't feel it works, find somebody else. As a therapist, if I'm not the right fit, I'm not offended. I'm not supposed to be. I want to make sure I get you connected to the right person.
That's right.
I also say, look, you can find as many barriers to treatment as you want. I can't afford it. I got to go to work. You can do all that. Okay, I'm not really sure what the outcome's going to be for you, but I would say, similar to Johnny, interview the therapist, get on the phone, do a consult, and understand while you may say, yes, this is the person for me, if it's not and you realize it right away, pivot. Go find somebody else. Don't avoid it.
Yeah. It's interesting that we all have the same impulse for advice. Because that's the initial thing I was thinking too, of find the right fit with a therapist. And to your point, Craig, don't be hesitant to try a few out in the beginning.
Right.
And some of it's kind of a gut thing. When you get in the room with someone, maybe even talking over the phone, when you get in the room with someone, it's like, is this someone that I can vibe with?
Yeah.
And understand that vibing with doesn't mean they got to be your buddy and your pal.
That's right.
You want somebody who's going to be able to challenge you. But that's the thing. Iron sharpens iron. When you truly have somebody in your life, male or female, that can look you in the eye and call you on your stuff, you're going to respect that person. You're going to be able to hear them a little differently. If you get you a yes man, or if you get you somebody who's going to coddle you and make you feel good about yourself, even if you're not doing what you need to be doing, that's not really going to benefit you, and it's only going to replicate what you've been experiencing up till now.
Right on.
Well, I guess we're going to have a part 2 in this conversation.
Oh, part 2's got to happen.
There'll be a part 2.
Part 2's got to happen.